Hi, good afternoon. My name is Terika Thomas Mills, and today I'm going to be demonstrating subcutaneous injection. I am going to start by verifying my physician's order. I'm going to verify the 6 right of med administration. I'm going to ensure I have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. I'm going to gather my supplies, and I'll do any drug dosage calculation that I have to do. Today the doctor has ordered 1,000 units of heparin sub B, sub Q, I'm sorry. It is supplied in 10,000 units in 10 mLs. So I'm gonna drop 1 ml, and that will give us 1,000 units in 1 ml. I'm gonna gather my supplies. I'm gonna enter my patient's room, knock, knock, knock. I'm gonna close the door behind me for privacy, and then I'm gonna perform hand hygiene. Hi sir, good afternoon. My name is Terry. I'm gonna be your nurse today. Can you verify your full name and date of birth? Okay, so Mr. Mills has correctly identified himself using 2 identifiers, his name and his date of birth. Okay, Mr. Mills, so do you have any allergies to any medication, any food, any environmental or maybe seasonal allergies? No? Okay, so today your doctor has ordered heparin, today your doctor has prescribed a heparin injection, and heparin is an anticoagulant that is used to treat or prevent blood clots. It's basically just interrupts your body's clotting mechanism, which can prolong or even prevent clot formation. Some of the side effects of this medication are going to be injection site pain, easy bruising is also common. Some more concerning side effects are going to be dizziness, shortness of breath, severe abdominal pain, nausea or vomiting. Just let me know right away if you experience any of these symptoms. Other persons have also complained that they might have a stinging or burning from this injection, so just be aware, okay? Do you have any questions? No? All right, so I'm going to perform my hand hygiene, and then I'm going to apply my gloves. So I am going to ensure that I have the right syringe and the right needle for this medication. So I have for this sub-Q injection, so for this syringe I have a 1 to 3 milliliter syringe, and I have a 25 gauge needle, and this is actually a 1 inch, but I would probably consider a 5/8 inch for a sub-Q injection, depending on my patient's site. I am gonna start by cleaning my vial, the top of my vial that contains my heparin, with my alcohol prep pad. And then I'm gonna take my syringe, and then I'm gonna withdraw 1 ml of air. Okay. Okay, I'm going to carefully uncap my needle, and then I'm going to inject the 1 ml of air in my vial. And then I'm going to withdraw my medication. gonna tap for any air bubbles and make sure that it's on that 1 ml, that 1 ml mark. I'm gonna carefully recap my needle using the one-hand sweep technique. And if this was prepared elsewhere, I would label my syringe with my medication and my dose. So let me show it to the camera. It's actually 1 ml. Okay, 1 ml. Next, I'm gonna select the site for my heparin shot. For a sub-Q injection, you could select the you could select the outer aspect of the upper arm. You could select the abdomen, or the you could select the abdomen below the costal margin to the iliac crest, or the interior aspect of the thigh. But because it's a sub-Q, because it's a heparin shot, I'm gonna choose the abdominal side and make sure we're at least 5 centimeters or more from the umbilicus, left to the left or the right. I'm gonna inspect the site, make sure there's no bruising or skin irritation or edema. Next, I'm gonna palpate the skin for any tenderness or any masses, and I'm gonna verify that the patient hasn't had any injection on this site recently. I am also gonna do a test of needle size, and in order to do this, I'm gonna do the fold of skin, and I'm gonna make sure that the needle is at least half of the length of that fold. All right, so next I'm gonna clean my site using my alcohol prep pad. I'm gonna clean in a circular motion from inside out, and I'm gonna clean about 5 centimeters. So I'm gonna do it in a circular motion from inside out about 5 centimeters. All right, I'm gonna let this dry. Make sure I don't fan it or blow on it. I'm gonna let it air dry. So now I'm gonna, to administer the injection, I'm gonna go ahead and I'm gonna pinch the skin, and then I'm gonna take my needle, and then I'm gonna inject. I'm gonna inject at a 45 to 90 degree angle, and since it's a heparin shot, I'm injecting at a 45 to 90 degree angle, and since it's a heparin shot, I'm gonna maintain that pinch, and then I'm gonna slowly inject the medication. However, if it was another sub-Q injection, I could release the pinch, and then I could use my non-dominant hand and hold the needle so that it is stabilized while I administer the medication. So since it's a heparin shot, I'm gonna inject it over a 30 to 60 seconds. Do it slowly over 30 to 60 seconds. I am gonna apply my gauze, and since heparin is an anticoagulant, I'm gonna be holding this here for about 30 to 60 seconds, ensuring that I'm not massaging the site. If this needle has a safety mechanism, I could engage it. I would engage the safety mechanism and discard it in the sharps container. I could also apply a bandage if necessary. But first, I'd have to ensure that the patient's skin, the patient would not have an allergic reaction to the bandage. I am gonna gather all my supplies. I'm gonna discard them, and then I'm gonna remove my gloves. I'm gonna perform hand hygiene, and then I'm gonna go document my procedure.